My name is Chris Holland. I'm a consultant in intensive care at King's College Hospital and a professorial teaching fellow at the University of Surrey. I've been involved with the MACE programme since 2010 and I've co-created and taught in several of the modules that you will participate in on the programme. In the Assessment in Education module, I aim to introduce you to the theoretical and evidence base for contemporary approaches to assessment in the health professions. This module can be taken as an optional module at either certificate or diploma level. Determining if a healthcare professional is safe, competent, skilled and professional is one of the most important educational activities we participate in as educators. Most healthcare education courses and programs involve extensive and high-stakes assessment of students or trainees. Assessment is usually the gateway to professional practice and has a direct impact on patient care as a result. Everyone involved in the education of healthcare professionals is therefore involved in preparing their learners for assessment or for making that assessment of readiness. In this module, we will consider the general theory and practice of assessment and evaluation in education and in clinical educational contexts specifically. I hope that the module will encourage you to explore and expand your notions of these concepts with the help of existing research and theoretical literature and discussions in the module sessions. As with all other modules on the MACE programme, this module has been designed with both the HEA and Academy of Medical Educators professional standards and frameworks in mind. Each week, we will review a different aspect of assessment. The competency approach to professional practice, which has become accepted across the health professions, is the conceptual starting point for work in the module. Building on this, you will critically explore a combination of theoretical and empirical literature on assessment, and I will be challenging you to think about other ways of conceptualizing your role in the system of assessment which your learners experience during their clinical training and practice. The objective in doing this is to get you to consider the importance of your role within an assessment system for learners themselves, your institution, accreditation bodies, and the community. In the first week of the module, we'll consider some of the basic perspectives and philosophies of assessment and evaluation and how they are applied in healthcare settings. We will consider some of the key contemporary debates around assessment, the purpose it serves, and the power it has within our programs. In the second week, we will begin to discuss the ways in which some of the learning theories and theories of assessment play out in healthcare settings specifically. We will look at some different assessment strategies and discuss their various strengths and weaknesses. In the third week, we will move away from the different techniques of assessment and consider the theory and practice of ensuring valid, reliable and generalizable assessment. What do psychometrics of an assessment tell us, and how can we make this information useful for learners and assessment candidates? In week 4, we turn to the challenge of assessing attributes of clinical practice. How do we determine if performance rather than knowledge is adequate, and what domains of practice do we need to consider in making that assessment? In the final week, we will have a plenary review of the modules so far, and we will discuss what the current challenges facing contemporary assessment practitioners are and what avenues we can consider in trying to find a way forward. We will also consider the assignment for the module in the 5th seminar. For the assignment for this module, you will complete a critical appraisal of the literature in a closely defined area of assessment which is relevant to your professional practice. The assessment is designed to both assess your learning from the module and to give you the opportunity to further develop specific scholarly skills of critically reflexive writing, conducting a wide literature research, and then narrowing down your results and choosing 3 to 5 papers and justifying why these are relevant to your professional practice. The assignment is an extremely broad remit, and so you will have to consider which aspects of assessment you will explicitly attend to. The aim of this aspect of the assignment is to give you the opportunity to engage in this aspect of academic practice as part of the overall trajectory to being prepared for your dissertation. You will need to start thinking about this aspect of your assignment from the outset of the module. To use the seminar series as a launchpad into the main work of your assignment, you will have the opportunity to make a short presentation on your work on the assignment during the last 2 seminars of the series. The other, overarching aspect of this assignment is meant to test your critical judgment by asking you to demonstrate your processes of identifying articles relevant to your context and to undertake a critical review of these articles. I hope that this short preview of the module has been helpful, and I look forward to meeting you in the future.